this is your first time on my channel, please go take a peek in the description box down below where I will link the rest of my videos. If you're just tuning in again, welcome back, and today I'm going to be talking about some questions that I asked my doctor about my surgery that I will be having this June for my scoliosis. So let's get started. One of the first questions I asked my doctor was this question: what am I going to do about travel? When can I go out and do things? When will I be able to do all these things I'm doing now? And he said that the first few weeks you're going to be sore. You're not going to want to do much. It's going to take a little while to get back into your normal habit of things. There's no legitimate limitations. However, you're not going to want to do too much at that point in time. Another question I had from my doctor was about blood transfusions. Should I get my own blood donated? Should I use a blood bank? Will I even need one? He said most likely you won't need one. At the hospital that I'm going to, Boston Children's Hospital in Boston, Massachusetts, he said that they have a new system that basically recycles your blood during surgery, so I should be all set. He said that if I did need a blood transfusion, it's way safer and better to use the blood bank rather than donate my own blood. So I'm trusting my doctor on this one. Your doctor may have a different idea, and again, all of these things are just what my head doctor has told me, so it might not be exactly what you guys would be going through. Pain meds. My doctor said I should be on pain meds for about 2 to 4 weeks. They will see how I'm doing at that point at the 2-week mark, and I may have to keep going, or I may be able to stop. It really just depends on how well I recuperate. Food. One of my personal top priorities. I love food so much, so for me, this was an important question to get from my doctor. When will I be able to eat? He said it really depends on how I'm feeling. He said, again, just as the traveling, there's no restriction. It really comes down to nausea and how nauseous I'll be after surgery, and if I will want to even eat anything, if I will want to even think anything's appealing. He says it takes about 2 weeks-ish for you to get your normal appetite back, so most likely I won't be eating too much, but I should be eating. And he said it depends on the person, depends on how nauseous they get, so I guess we'll just have to see. Rods. I will have 2 rods because I have an S-curve, so one will be pushing one way and one will be pushing the other way. There's a couple type of rods, but at my hospital they use titanium rods. Sad to say, this is another one of those huge questions that I wanted to know. Hospital gowns. I don't want to be in those hospital gowns at my hospital. They're the blue ones. I don't know what they are at yours, but they're the hospital gowns everyone's in. I know they're cleaned. I know they're sterile. I know that they just work best for surgery, but I want to feel comfortable when I'm there, and I want to feel like I look cute. So I asked my doctor, and he said for surgery and right after surgery, he said you have to wear ours because it must be some sort of requirement for them. But afterwards, once I'm able to move, once I'm comfortable enough and like my brain's back to kind of ish normal and I'm ready to attempt to put something else on, he said I can definitely have my own. So I'm actually planning on making my own. So let me know if you guys want to see a video on how to make your own hospital gown. Add some comments down below and I will respond to you because I am really thinking about making my own for this surgery. When I asked about sleep to my doctor, I meant sleeping positions, how well I'd be able to sleep, all of those different things. Basically, he said it really depends on the person, again, pain-wise and med-wise, how the meds work with you, on how well you'll be able to sleep. Sleeping positions, you can't bend, twist, or lift for 3 months. So he said try not to do those twisting or bending and sleeping. He said, but really anything that makes you comfortable and anything of that sort, that's your go-to. Currently, because of my back pain, I am taking a lot of medicine. At 6 in the morning, I take 2 Aleve and a Tylenol 500. At 10 o'clock, I take another Tylenol 500. At 2 o'clock, I take Tylenol 500. At 6 o'clock, I take another Tylenol 500 and two Aleve. And then again at 10 o'clock at night, I take Tylenol 500. I take 1,000 then for my 8 hours of sleep because of the pain that I'm in. So my main question was, when do I have to stop taking these? Because it's been helping me a lot, coping with this pain that's been getting vigorously worse for me. I don't know if it's knowing that there's actually something wrong with me and that I'm not insane, or that it's legitimately getting worse. I haven't had x-rays since February, so I'm not 100% sure which way it is. But so that was a really important question for me. When do I have to stop taking it? He said Tylenol I can take up until the day of surgery. With my Aleve, I have to stop taking a week before. So I go in on the 10th for my pre-operation appointment. So I'll have to stop taking it at that point. All of my stitches will be dissolvable. My surgery is going through my back. My doctor said going through the front is only when you have a really, really bad curve. And he said that it does have some risk with the lungs. And because mine isn't horrendously bad, yes, it is a 41 degrees on my top curve and 51 on my bottom curve. That still doesn't make it horrible enough that they'd have to risk my lungs and go through the front. So my doctor didn't have too much information on this. I guess no one's actually tried to vlog their experience at Boston Children's Hospital before. So I am getting in touch with one of his assistants at the moment. But once I figure out my answer, I will definitely let you guys know. And there'll definitely be pictures taken. I know you can take pictures. So if I can't vlog, there'll definitely be pictures. And I will, like I said, I'm hoping to vlog when I get home. So if you want to see vlogs once I get back to my house, because I know there aren't too many here on YouTube, let me know and send that in the comments down below. Rods don't get flexible over time. This is something that people are very confused about and don't understand. If my back is fused together with rods, how do I move? Um, it really ends up being, yeah, you can still bend because your thoracic, which are all of your vertebrae in the middle of your spine, they don't move when you bend. When you bend over, they stay pretty flat. So those are the ones that I'm mostly getting fused together, so I won't have a problem. Talk to your doctor about what vertebrae you're getting done. If you're getting lumbar, which are the ones down bottom that make your back curve, those are a little bit more tough because you can't bend those, and that's what you use to bend up and down. So definitely, like I said, talk to your doctor about how you are bending, but no, rods don't ever get more flexible. My doctor said I will be able to go through metal detectors and most likely won't set them off. This is a question that is definitely 100% I'm positive going to be different with each hospital. My hospital is 50% double rooms and 50% single rooms. If you don't know what I'm talking about, basically a single room is when you're by yourself in a room. You get the whole room to yourself. So normally like ICU care and different things like that, cancer units are normally single rooms. And other units that are like emergency rooms, those are single as well, but there are double rooms too, which is basically two beds and you have a curtain in between you. The only thing with that is I know that they try to put same genders in each room. So if I was in a double room, I'd be with another female, which makes it, I don't think they allow the opposite gender to be staying with you. So since I'm younger, I would obviously want a parent or someone staying with me when I'm there overnight. So I don't think my dad can stay with me. I know from some family things that they don't allow opposite genders, but it might be different at your hospital, so you might want to check that out. ICU also stands for Intensive Care Unit, which is where normally where people go after surgery for a little while. My doctor actually said that I won't be going there. Most hospitals do, I believe, have you go to the ICU after spinal surgery because it is such a huge surgery. But at my hospital, I guess they're not having me, so definitely check with your doctor on that one. Here on YouTube, I've been watching so many videos of all these people and how they've gone through surgery and all of this. And a lot of them have said that they have been in the hospital from about 5 days to 7 days. And some people who have complications have been there for 2 weeks. I watched these and I was like, all right, so I'm going to be there for a while. That's going to be okay. But Surprisingly, when I asked my doctor, he said I will only be there for about 3 to 4 days. Obviously, if something ends up going wrong, I will be there longer, but he said normally it's just 3 to 4 days, so I'm actually pretty ecstatic about that. This may sound like a really stupid question, but honestly, think about it. What is it that's really bothering you? I bet you don't know. Is it the muscles? Is it the scar? Is it the bones? What is it? That was a question I would really was kind of stumped on. What is it that's going to be bothering me? So my doctor, I asked him, and he said that it is normally the muscles because my spine is going from an S curve to straight. My muscles have to shift, and they're not used to being in these places. Some of them are squished more, some of them aren't. They are basically in there manually moving different things around, so it's just uncomfortable and sore. Okay, so what are they actually doing during your scoliosis surgery? They say they are fusing your vertebrae together. But what does that mean? Fusing your vertebrae, as my doctor says, is basically that he's going to take your spine, C curve or S curve, whatever you have, straighten it out so you have a straight spine by putting rods on either one side if you have an S curve or both sides if you have one side if you have a C curve, both sides if you have an S curve, so that your spine stays straight. They use rods and then they also use pins down the sides. Then, once that's in place to make sure that it all stays together, they put some bone graft right on top. Sitting, standing, or laying down? That's the question. Sitting, you have pressure. Lying down, you're just uncomfortable sometimes. And standing, obviously, you have some more pressure as well. My doctor said most people, when they're laying down, they don't have the energy, they don't have the wanting to stand up or sit. He said, but normally, once people are in those positions, they are the most comfortable. So if you're uncomfortable laying down and you don't know what to do, and you're after surgery right now, try your best to stand up, try your best to sit. But I want to hear what you guys, if you've gone through this surgery, if you're going through it right now, if you've had it a while ago, recent, last week, in the next week, tell me what you think is best for you or what did work best for you. I want to hear about you in the comments down below, so maybe you guys can help me and everybody else. So another big question for me is driving. I have a lake house that is about 2 hours from my house, so I want to go there during the summer. I want to see my family. I still want to live a normal life during this recovery, even though it is going to be 3 months, 3 to 6 months. I want to have a normal life. So I asked my doctor, how long will it be before I do you think I will be able to be driving there and be in the car for 2 hours? He said at least 2 weeks, but it could be up to 4 or maybe more. It really just depends on how much oomph I have. He said if I really want to go, you should have the availability to maybe drive a little bit, stop, lay down for a little bit, maybe move positions, like have a couple like breaks in between. He said if you really have to go there or really want to, he said you should be able to. I just wouldn't push it less than 2 weeks. Since my surgery is in the summer, I wanted to know when can I start swimming. My doctor said that I can't start swimming until 3 months after, so really I won't be doing too much swimming this summer. Um, However, he said I can dip or lay in the pool at about 2 weeks. So if I had a raft or something like that, I could do that. Last but not least, showers. I didn't know when I could take a shower because I didn't know how I could get my scar wet or things like that. He said that they at my hospital will have me take a shower before I go home. So I will be able to take them at home as well. And apparently, from what I'm understanding, I will just have to be changing the bandage on my back after every time it gets wet, just in order for my back to stay dry and not get an infection. Alright guys, well that gets to the end of our video. Thank you so much for watching. I know this is a long video, but if you are seeing this outro, I am very happy that you watched it. If you have any questions left, please DM me on Instagram, which I will leave in the comments down below. Add a comment down below and I will respond to all of them. Anything that you want to get a hold of me can or know me on anywhere, just send me emails, send me anything you need. I am here for you and I want to make this easier for you. If you have any ideas for what you want to see, I'm hoping to do a hospital bag video. I want to do a video after my pre-op. Maybe if you guys want to see a vlog of my pre-operation appointment, anything like that. Please comment down below because I want to hear your ideas and I want to help you guys. This is why I'm doing it. Thanks so much for watching. See you soon. Bye.